Bronchiectasis. A comprehensive overview of symptoms, causes, and management. Bronchiectasis is a chronic, progressive lung disease characterized by permanently widened airways. This structural change leads to mucus buildup, increasing the risk of bacterial infections and chronic inflammation. While there is no cure, effective management strategies can significantly improve quality of life and slow disease progression. Understanding the condition, its types, causes, diagnosis, and treatment is crucial for individuals affected and healthcare providers alike. Understanding the types of bronchiectasis. Bronchiectasis isn't a single disease, but presents in several forms based on the extent of airway damage. The three main types include cylindrical. Airways are widened but maintain a relatively normal shape, representing the mildest form. Varicose. Airways are irregularly stretched, resembling varicose veins. Cystic. Airways develop sac-like pockets filled with mucus, the most severe type. Bronchiectasis can also be localized, affecting specific lung areas, or diffuse, affecting multiple areas. The specific pattern helps doctors understand the severity and guide treatment. Recognizing the signs and symptoms. Bronchiectasis typically develops slowly over years, often after a respiratory infection. Common symptoms include persistent cough, daily, productive cough that lasts for months or years, excessive mucus production, large volumes of phlegm or sputum coughed up daily, recurrent infections, frequent chest infections or colds that worsen symptoms, hemoptysis, coughing up blood, fatigue and shortness of breath. Other symptoms include chest pain, wheezing, bad breath, and in advanced cases, nail clubbing, rounded fingertips. These symptoms don't appear overnight. They gradually worsen over time, making early diagnosis essential. What causes bronchiectasis? The root causes of bronchiectasis are diverse, ranging from genetic defects to environmental factors. In roughly 40% of cases, the exact cause remains unknown. However, known contributors include severe respiratory infections. Repeated or severe infections can damage airways. Genetic conditions. Cystic fibrosis, primary ciliary dyskinesia, and alpha-1 antitrypsin deficiency are linked. Immune deficiencies. Conditions like HIV or immunosuppressant medications weaken lung defenses. Autoimmune diseases. Rheumatoid arthritis, lupus, and other autoimmune conditions can cause inflammation. Airway obstructions. Tumors or foreign objects can obstruct airflow and lead to damage. Diagnosing bronchiectasis. What to expect. Diagnosis begins with a thorough review of symptoms and medical history. Doctors use several tests to confirm the condition. Imaging, chest X-rays and CT scans reveal airway dilation and structural changes. Sputum cultures identify bacteria or fungi in the airways. Lung function tests assess airflow and lung capacity. Bronchoscopy allows direct visualization of airways and sample collection. Blood tests rule out infections or autoimmune conditions. Accurate diagnosis is crucial for initiating appropriate treatment. Treatment and management strategies. Bronchiectasis is a chronic condition requiring long-term management. Treatment focuses on keeping airways clear, preventing infections, and reducing inflammation. Airway clearance. Daily techniques like active cycle of breathing technique, ACBT, forced expiration, chest, physiotherapy, or handheld devices loosen and remove mucus. Antibiotics fight bacterial infections, either orally, inhaled, or intravenously. Bronchodilators open airways to ease breathing. Anti-inflammatory drugs, corticosteroids reduce airway inflammation. Mucolytics thin mucus for easier clearance. Brensocatib, FDA-approved medication to reduce flare-ups in non-cystic fibrosis. Bronchiectasis. Severe cases may require oxygen therapy, bronchial artery embolization, or even lung transplantation. Lifestyle changes for long-term health. Living with bronchiectasis requires proactive lifestyle adjustments. Avoid smoking and secondhand smoke. Irritants worsen symptoms. Stay hydrated, thins mucus for easier clearance. Maintain a healthy diet, supports immune function and reduces inflammation. Vaccinate against respiratory infections, protects against worsening conditions. Exercise regularly, improves lung function and overall fitness. Prognosis and outlook bronchiectasis is irreversible, but early diagnosis and aggressive treatment can maintain a normal life expectancy. Severe cases, particularly those with underlying conditions like cystic fibrosis or COPD, carry higher risks. Access to quality care and adherence to treatment plans are critical for long-term health. In conclusion, bronchiectasis is a complex lung disease that requires lifelong management. By understanding the symptoms, causes, and treatment options, individuals can work with healthcare professionals to minimize disease progression and maintain a good quality of life.